Good afternoon and welcome to this intriguing satellite symposium. I'm going to say a few words as president of lDF to welcome you to this very interesting session, which I'm sure you'll find very exciting. I'm not sure who's going to win yet, but we'll see. But firstly, just to remind you, as you probably heard yesterday, on the 6th of December, the latest data from the lDF, the global prevalence of diabetes. And sadly, the statistics are depressing. Now 1 in 10 adults across the world has diabetes. Many of these, especially in developing countries, are undiagnosed, and 80% of live births affected by hypoglycemia in pregnancy, and the problems are ongoing. But also, we celebrated last month the centenary of the discovery of insulin in Toronto by Banting, Best, Collett, and MacLeod. So these are very important times. But sadly, diabetes remains a major problem with more than 500 million people across the world. So this symposium is looking at the potential for artificial intelligence to help us. So let me just say a few words about my entry into this area, in my area of diabetic foot and lower limb problems. And we could say that times are changing. The traditional is you see a patient, you give prescription and medications, provide education, assess the feet, give assessment of offloading, and ask patients if they're wearing the appropriate shoes that we gave them. The future may be involving artificial intelligence, smart technology. So remote monitoring, remote consultation for medications, remote monitoring for high-risk feet, remote fitting even of shoes and offloading, although that's a way away yet, and remote monitoring of changes in the foot. So the solution in the future may be continuous monitoring of foot problems, and also sensor-enabled wireless devices to help us. So smart technologies are already being used in diabetic foot care, such as screening for temperature, using smart socks even, and continuous pressure monitoring. So help the patient to see the problem, see it, save it. So we can give them something. The dark is dangerous. They can record their own foot pressures and know where to look under the feet. Seeing is believing. So smart technology can help us here. Here are smart socks that can feed back to the patient and the clinician. There's a difference between temperature between the 2 feet, which warns of subsequent breakdown. So I think artificial intelligence, no doubt, has a promising future in diabetes care. Diabetes is no longer the leading cause of blindness in adults in my country. Why is that? Because of retinal photographs and retinal screening. But now artificial intelligence is being used to screen the photographs that are being taken. Here's one example. In diabetic foot problems, I've shown you a digital revolution of home-based diabetic foot care. And I think the Internet of Medical Things will provide us with huge opportunities for the future. And let me end by saying that I think that artificial intelligence is not a replacement. It's an addition to good clinical practice. And being a believer in good clinical medicine and the importance of a good history and examination, let me leave you with the words of the Irish physician Corrigan, whose sign of the collapsing pulse of aortic incompetence all medical students know about. He said that the trouble with most doctors is not that they don't know enough, but they don't see enough. So despite the use of artificial intelligence, and this is going to be a fascinating competition, and I'm not sure who's going to win, but you'll find out in an hour or two. But please remember, always examine your patients with diabetes, and that includes all aspects for signs of complications, signs of foot problems, and so on. Always look and see, but also embrace artificial intelligence, which is going to help us so much in the future of diabetes care in the next century. Following a century ago, the discovery of insulin, now we're moving forward, smart technology and artificial intelligence. So Thank you for asking me to introduce this, and I hope you will find this most enjoyable, and I'm sure and have no doubt that you will. Sheshe, thank you.